Greetings and welcome to In-Depth. I'm Dike Rostant. Trinidad and Tobago became a member state of the World Health Organization the year after independence. Now, 3 years later, we joined the Pan American Health Organization. Now, the PAHO WHO country representative, Dr. Erica Wheeler, she joins us now to give an overview of work generally in the region and specifically in Trinidad and Tobago. Welcome, Dr. Wheeler. Thank you so much for joining us. We want to start from the ground up. Please give us an overview of PAHO and its role in the region.
Well, thank you for having me and for the question about PAHO. I don't know how many of your viewers know about us, but we are what I would call a hybrid organization. We were set up in 1902 as the Pan American Sanitary Bureau. We're the oldest public health agency in the world, but we joined WHO, became the PAHO became the region of the Americas arm for WHO after the Second World War in 1948. We just celebrated in general our 120th anniversary. So we are a technical agency that provides cooperation in health to something like 52 member states and territories, including overseas territories in the region. And we also cover the Dutch and the French territories. And we provide support and technical cooperation in several areas on health systems, on areas like climate change, on non-communicable diseases like cancer, hypertension, diabetes, but also communicable diseases. So that's why we were so much part of what happened during COVID-19, because we address all the vector-borne diseases. But we look at what some people may call soft areas, but very critical areas, such as the social and environmental determinants of health as well. This office here covers not just Trinidad and Tobago, but we cover the 6 Dutch entities as well. So our work really and our mission is to improve the quality of life of the people of the Americas. And our motto really is social justice and equity and universal health. This is at the heart of what we do, because primary health care, and not just when I say primary health care, I don't mean care only at the first level, like in health centers, but that approach, which means serving the majority of the people in the population, that is what we do. So we have a very broad brush of work. We cover mental health as well. So there are many things that we do. And our line ministry, although it is the Ministry of Health, our mandate really is to work with any of the government ministries that support health. So we really take a health for all approach, that broad approach to addressing health issues in any country where we are.
Well, and that seems like a very tall order, Dr. Wheeler, in terms of like looking at the breadth and scope of what it is you're doing. But if you had to break that down to itemize the points of focus, what are some of the things that are leading on that totem pole or that hierarchy of importance?
Well, to be brutally honest, we don't have a hierarchy of importance. Everything is important that I just mentioned. It just depends on what the country chooses to focus on. Because the way we work is this. Yes, we work on all of those things. And just to give you a little bit of background, when in 2019 we were setting up our plan of work for the following 6 years up to 2025 inclusive, we consulted with the member states because we are a member state organization. And I think that is important because it is the member states that tell us what the priorities are. We never tell member states what they should be doing. What we do is respond to their needs. So the priorities are not set by us, they are set by the member states. And the member states agreed on, wait for it, 25 different areas of work that they would like us to work on. And it includes, when I said climate change, disaster preparedness, which is one of the key areas, since you are asking about priority areas. So member states identify those areas. So climate change, which includes disaster preparedness and planning, the logistics, because we have something called a strategic fund, which provides things like PPE, which you would have heard a lot during the pandemic. And we have a revolving fund which provides vaccines and syringes and so on, which, of course, again, was a priority during the pandemic. And to some extent, vaccines still are. So that's one area. Another key area, another priority area is non-communicable diseases, because the region of the Americas is one of the most, if not the most inequitable region in the world of all of the 6 WHO regions. So we have a lot of challenges in that respect. So non-communicable diseases, so diabetes, hypertension, and also we struggle with issues of obesity in the Caribbean area in particular. So non-communicable diseases are another priority for Trinidad and Tobago, the rest of the Caribbean, and Latin America. It's something that we are struggling with. And of course, we are leading SDG 3, the Sustainable Development Goal 3 about health and well-being. So therefore, that is a big focus, to get data, to be able to analyze the data, to make policy, to advise the government, and then to support the government, because although we are not a funding institution, we do provide some funding, we provide training on an ongoing basis to the government. So non-communicable diseases is a big issue. Another area which, coming out of the pandemic, has really come quite high up on the agenda is mental health.
And just
And of course,
I don't want to cut you before you get into full flight looking at that topic of mental health. So we take a short break, Dr. Wheeler, and we return
Sure.
to this conversation, this very timely conversation. We are speaking with Dr. Erica Wheeler, country representative for PAHO. Stay with us. We return with more. Welcome back. We are speaking with Country Representative PAHO, WHO Country Representative Dr. Erica Wheeler. And just before we took the break, you started to speak about the importance of doing work to facilitate mental health. Please continue.
Yes, thank you. So I was mentioning that coming out of COVID, mental health has become a priority for governments of the region. In Trinidad and Tobago, they are focusing a lot as well on deinstitutionalization, which means bringing mental health services closer to the community rather than in large asylums. But mental health as a whole, because of the isolation, because of the fact that, we've had to distance ourselves from people close to us. In some cases, we've had to isolate, and even now we still have to be cautious. This has had an impact on the mental and psychological health of both adults and children. So we have been doing quite a bit of work on youth and mental health, youth COVID and mental health, as well as adolescent mental health in general. We've been running programs with young people and children on mental health to find out how they feel and what are some of the solutions that they have suggested to us and how we can address their issues from their perspective, not from the adult perspective, but from the perspective of the child, the teenager or the adolescent, and young people, because we've worked across the board. Of course, we had to get permission from parents to involve children, and we've surveyed children as young as 10 years old to tell us about how they feel about their mental health and what they think we should be doing. So that has been another priority area of work. Of course, needless to say, I could talk about COVID forever. So COVID continues to be a key area of work because we had to support the government to prepare to receive the vaccines, because there was so much going on behind the scenes that the public may not have known, such as there were certain steps which had to be taken to prepare the country before they could even get the vaccines. Because you need to remember, and everyone needs to remember, that we have never, since 100 years ago when there was the flu pandemic, we've never had to do mass vaccinations. We're used to doing vaccinations of children, of course, before you go to school, if you have to travel, but not a whole population. So that was quite a task. And we continue, as far as the government requests us to provide training, to provide vaccines, to provide even vaccine refrigerators. We secured 44 brand new solar vaccine refrigerators for the government of Trinidad and Tobago. We are paying for their installation and the training and so on. So things to do, not just only with vaccines, but then the spillover into immunization as a whole. Because as a result of COVID and all of the negative social media information, immunization has dropped, which leaves countries vulnerable for resurgence of common diseases like measles, mumps, and rubella. So, being able to keep up with immunization is critically important. So, that's an area that we are continuing to support the government in. And climate change. Climate change for health, we have collaborators. We work with UE as part of their regional planetary hub. But we have a project in general for PAHO called Smart Facilities, where we do a lot of retrofitting to ensure that buildings are climate safe. And we do training of people at the regional health authorities to make sure that they know what to do. And the final one I want to mention as a priority, which is the most recent one on International Women's Day, we launched the guidelines, national clinical and policy guidelines on violence against women and girls. This, you will know, of course, is something very topical, something that needs to be addressed. So we have been working on that. The Minister of Health approved the guidelines 15th of August last year. We worked with also Ayanna Webster Roy in the Office of the Prime Minister, who reviewed them, and they were finally launched this year. So these guidelines, they do several things. They make persons in the health service more aware of how they should take care of persons who have suffered intimate partner violence and sexual violence, because the official name is National Clinical and Policy Guidelines for Interpartner Violence and Sexual Violence. So we are training persons in the health sector, doctors, nurses, as well as social workers too, so in the social services sector, and administrators. So it's not just health. We have already have a system that was introduced into Trinidad and Tobago, and the Ministry of Health has rolled it out across all the health centers, called the Perinatal Information System, where we gather information on women during the perinatal period, which is from about 22 weeks or when the baby reaches 1,000 grams up until 7 days after birth. So we record all the information for them. But to that, we have now added a component to record any violence against women. So it will go back quite a way into, when the woman is at 22 weeks up until 7 days after the birth of the child, and capture if there have been any incidents of violence. The forms are in paper, but they're also electronic. And this enables the government then to capture that data and use it to know how to better address the needs of women and girls who've been exposed to violence. So we have trained over 250 people across all of the regional health authorities. We've trained the Tobago House of Assembly. We are training more trainers now. We have developed a manual to guide people how to use the form. And now with the electronic form, which we call the Perinatal Information System Violence Against Women form, we will be training persons how to input the data and also how to use it. And we are working with our regional office. It's based on global guidelines by WHO and the tools that have been piloted around the world. And we are working very closely with the Directorate of Women's Health because, of course, without them, we could not even have developed the guidelines because we work very closely for about 18 months, going on 2 years to bring these guidelines to fruition. So we have, as you see, been very busy, and I have just touched on some of the things we have been doing. That is not the breadth of our work by any means, but I have mentioned the priority areas. So we are rolling out these guidelines now. We are doing the training, more training of trainers. And incidentally, the guidelines are the first in the Caribbean, the English-speaking Caribbean, and the Caribbean as a whole. And the violence against women component, the electronic form, is the first country in Latin America and the Caribbean that will be using these guidelines. So we are a model country to the other countries to roll out some of the things that we do here on the ground. And I have not even touched on hearts, which addresses hypertension and diabetes, which we have rolled out with the government across all 102 health centers. And that is more to do with, the high number of people who die from hypertension, which is one of the key non-communicable diseases that we have in this country. So we're pretty busy, as you can see.
Pretty busy. And this is why we wanted to start the conversation on PAHO's role in the Caribbean and, well, the region and specifically Trinidad and Tobago with you. And we will have follow-up conversations looking at specific items along your breadth of endeavors. But we want to thank you so much, Dr. Wheeler, Dr. Erica Wheeler, PAHO WHO country representative, letting us know what is happening, what has happened, and what are some of the things still to come. And on behalf of the entire news team, I'm Dike Rostant. This has been In Depth with me. Thank you so much for joining us.